the hour. Welcome back. Thom Hartmann here with you. Mark in Birmingham, Michigan. Listening on WDTW. Hey, Mark, what's up?
Just picking up on your previous guest, I lived in Canada and Israel for quite a few years.
Mm-hmm.
I grew up in Canada, so I had experience with socialized medical systems.
Actually, neither of those are socialized medical systems. They're both single-payer healthcare systems. The government doesn't own the hospitals in Canada. They're privately owned. And they don't own the hospitals in Israel. They're privately owned.
Excuse me.
The UK is more like socialized medicine.
Okay, thanks. What happens in Canada is that all the resources get used up on what your previous guest called oil changes. People run to the doctor for the common cold, etc., things that you and I now wouldn't do. And then when you need cancer treatment or some type of heart surgery, the resources are minimized. Also, what happens is the government figures out...
Actually, no. No. That's a myth. The fact of the matter is, in Canada, if you need a hip replacement, you're going to have to wait 6 months to a year. But if you need heart surgery, you're going to get it tomorrow. And this is not in dispute. I realize the right-wingers love to go on about it, but it's not in dispute. And your call is going to provoke an avalanche, except for the fact that every single line is slammed right now, so nobody can get in. But typically, when people come on like you and say things like what you said, I get all these calls from Canadians.
Well, can I make one other point?
Yes, sir.
The other way that the government controls costs is they figured out how much it costs to, educate a doctor. So what they do is every year they cut the number of doctors they allow to enter medical schools. For example, in Windsor, when my doctor retired, I couldn't find a general practitioner. I had to call a colleague, and he had to call his doctor and say, look, I know you're full. You're not taking new patients. Can you please let he's a good friend of mine. He'll be a good patient. Can you let him in? So what happens is there's shortages.
Oh, there's a shortage here in the United States. Mark, when I moved to Washington, D.C., it took me 5 months to find a doctor that would see me within 6 months, just for a physical. For my health insurance that my health insurance company required. It took me 5 months of calling around. I could not find, and ultimately, you know what they have? Most of the doctors, or not most, many of the doctors in Washington, D.C., they're going to this thing where they're calling it concierge medicine, and you pay them a $3,000 cash payment every year, and just to be a patient, and then they limit their practice to like 100 or 200 people, and they don't take insurance. I mean, that's what's happening in the United States.
In a free market, the government is meddling already left and right. In a free market,
it is. I agree with you. This is, and in Canada, one of the problems that you have is because doctors make so much more in the United States, you've got a brain drain going on. You've got physicians coming to the United States to practice, the reason doctors make more in the United States is because the AMA and a couple of licensing agencies that are associated with them control not only the number of people who get in and out of medical school, but more importantly, the number of residencies that there are in the hospitals, and which you've got to go through in order to become a full MD. And this is a real problem in the United States, and our problem has gotten contagious, and it's affecting particularly cities like Windsor, which are right next door to the United States. But that is not a problem with how we're paying for medical care. The question is not, do you want the government to be paying for your health care or not? The question is, do you want the government to be paying for your health care, which a government that you can petition for redress of grievance, a government that you can replace, you can throw the bums out if you don't like them, a government that you can lobby, in fact, a government that you can become if you decide to run for political office, or do you want a giant transnational health insurance company providing your health insurance where if you try to petition them, if you try to talk back to them, if you try to pick at the CEO's house, you can get arrested? Which one do you want?
I want a monopoly. So if I don't like my insurance company, I go to someone else. If I don't like the government,
good luck.
And they're the monopoly,
Dream on.
Then there's
Dream on. You've got monopolies in the health insurance industry right now.
Well, why is that? That's government intervention.
No, it's a lack of government intervention. It's because Ronald Reagan stopped enforcing the Sherman Antitrust Act, and so these companies got bigger and bigger and bigger and bigger. It used to be that every state, insurance companies had to operate within a state and only within a state. When I grew up in Michigan, it was Blue Cross Blue Shield of Michigan that I was providing to my employees for free, and it was costing me $38 a month per person back in the 70s.
That's the government.
It was a non-profit organization. No, it was the government keeping competition in the marketplace.
No, I can't buy insurance in California. Why is that?
Because
the government is stopping me from doing that.
No, it's because the government has not been breaking up these big companies. They are not enforcing competition. They're allowing monopoly. You've got it upside down, Mark. You've got it upside down.
Why can't you buy health insurance across state lines? Who prevents you from doing that? That's the government. That's not the insurance companies.
Do you really want a situation where health insurance is like our credit cards and you find one state like North Dakota that says, okay, we're going to do away with all the regulations and standards and there will be no protection for you whatsoever, and all the insurance companies register themselves in North Dakota like all the credit card companies have done? The whole selling across state lines thing is a way of doing away with local control. Right now, every state in the union has an insurance commissioner who has the power to say, no, you will not screw the citizens of my state, and I will stop you from doing that. And some states are better at it than others. Some states have more aggressive insurance commissioners than others. But the big insurance companies and the conservatives are saying, oh, let's do away with those state insurance commissioners. Let's take away the power of the individual states to look out for their citizens. I think that I would think the conservative idea would be, let's have we the people have a government that is more responsive to we the people at the local level. And your suggestion that you be able to sell health insurance across state lines, these companies exist across state lines. United Healthcare is operating in all 50 states, but in each state they have to respond to the insurance commissioner of that state. And this sell across state lines mythology is just that. It's a mythology, and all it would do is make your health insurance even worse, just like with credit cards.